Assess a sick child. Ask, look, and listen. As in any regular assessment, you will evaluate a sick child by first identifying their signs and symptoms of illness. Let me show you what this looks like in practice. This is Nelly and her 5-month-old daughter Tabisa. Tabisa is not well. Take a look at how I assess her signs and symptoms. Hello, Nelly. Hello, Tabisa. How is Tabisa today?
Hello, Sarah. Good to see you. Tabitha is coughing a lot, and I'm worried about her.
A caregiver will usually tell you what is wrong with the child. For example, Tabisa has a cough. This is called a symptom. Ask the caregiver more questions to understand the child's symptoms better. How long has she been coughing, and is her cough getting worse?
She has been coughing for 3 days now. At first, she was coughing a little bit, but now she doesn't stop. She coughs the whole night, and we all don't sleep much. Even the neighbors are awake.
I'm sorry to hear that. Tell me, has Tabisa got a fever? Does she have a blocked or runny nose or a sore throat?
I can see that Tabitha is worse.
Okay, I understand a bit more about Tabisa's symptoms. Let me have a look at her and listen to any noises that she may be making. Looking at the child and listening to their sounds will help you identify signs of illness. A sign is what you will see or hear. For example, chest indrawing or grunting. As I am asking you questions and examining Tabisa, I am assessing whether her cough seems to be due to a mild or severe illness. I am also always looking out for any danger signs. Danger signs tell us that Tabisa is very sick and needs to go to a health facility right away. These are the key danger signs that we need to look out for in a child between 2 months and 5 years. A cough for 14 days or more. Diarrhea for 14 days or more. Most diarrhea will get better in a few days, but the child should be referred if it does not. It is important to look out for signs of dehydration or losing water. So, even if it hasn't been 14 days yet, but the child seems dehydrated, has no energy, or is very sleepy, they should be referred urgently to a health facility. Diarrhea with blood in the stool. A fever or underarm temperature of 37.5 degrees Celsius or higher for the last 7 days or more. Hypothermia, which is an underarm temperature of 35.5 degrees Celsius or less. Convulsions or fits or spasms. Not able to feed or drink anything. Vomits everything. Chest indrawing. Difficulty breathing. Unusually sleepy or unconscious. Red on the mid-upper arm circumference measurement tape. Yellow on the mid-upper arm circumference measurement tape and is living with HIV. Swelling of both feet. Have a look at the job aid that summarizes how to identify each of these danger signs. It may be helpful to use this when you are assessing a sick child and explaining what danger signs look like to a caregiver or family. Also, refer to the module on cough, which will cover the details of assessing cough. I'm going to make a note of Tabisa's signs and symptoms so that we don't forget anything and we can track how she is doing. Remember to complete the required documents from your organization and/or your Ministry of Health, or keep a record on your device if you have one. After you have completed your assessment, you will be able to decide whether the signs and symptoms indicate a mild, moderate, or severe illness. You can then take the next steps. To refresh your understanding of signs, symptoms, and danger signs, look at the modules in this course, such as those on cough and fever.